Hi everybody, my name is Phoebe Nieves. I am recording a presentation on the importance of glucose monitoring in type 2 diabetic patients with chronic wounds. By the end of this presentation, learners should be able to identify the differences between type 1 and type 2 diabetes, acknowledge the prevalence of diabetes in their own community, identify risk factors for diabetes and the pathophysiology of diabetes, and identify how elevated glucose levels in the body affect healing in diabetic patients with chronic wounds, and identify treatment modalities for the type 2 diabetic patient. So what is diabetes? Diabetes mellitus is a disease characterized by high levels of glucose in the body and a lack of insulin secretion or production. In 2018, 34.2 million Americans, which is roughly 10% of the population, was diagnosed with diabetes. Diabetes is the 7th leading cause of death in the United States currently, and it costs Americans over $327 billion to take care of a diabetic patient. Now we'll begin by talking about the different types of diabetes that exist. There's type 1, type 2, gestational, and pre-diabetes. In this specific lecture, I'll touch on type 1 diabetes and give a general overview, and then we'll go a little bit more in depth into type 2 diabetes. Again, that'll probably be just a basic overview as well. If I wanted to go more in depth on the types of diabetes, that could take a lot longer than the 15 minutes that I'm allotted. So type 1 diabetes is when no insulin is being produced by the pancreas. This is most common in children and in young adults. It also affects more African Americans and Latinos than it does Caucasians. Because the population of individuals affected by type 1 are so young, they require heavy glucose monitoring due to their need for an insulin pump. And they also require a lot more education about how diet and exercise are going to affect their blood glucose levels. I see a lot of younger patients who are type 1 who have insulin pumps, don't know when their insulin pump ran out, when they need to get it refilled, just because of their lack of knowledge of this chronic disease condition that they didn't expect to have at such a young age. Type 2 diabetes is characterized by a lack of insulin production and decreased sensitivity to insulin. It's also a result of impaired beta cell function, and the beta cells are cells within the pancreas that actually create insulin. It's caused by a genetic predisposition, so it's hereditary and does run in the family, and also environmental factors like lifestyle, diet, exercise, whether you smoke, drink alcohol, and definitely different cultures are affected differently. So type 2 diabetes is much more prevalent in Hispanic, African American, and Indian cultures. So of those 34.7 million Americans that have diabetes, 90 to 95% of those are type 2 diabetics, which is roughly 30 to 32 million Americans. The average person is over age 45, somebody who smokes, somebody who is overweight or obese, somebody who has a more sedentary lifestyle, and also has other conditions like hypertension and hyperlipidemia. Somebody like that is more likely to get type 2 diabetes than somebody who does not have these risk factors. So how does diabetes even come about? Diabetes is a result of the lack of insulin production or secretion by the beta cells or the island of Langerhans cells within the pancreas. These cells release amounts of insulin in increments which stabilize the glucose range to be between 70 and 120. The amount of insulin produced is supposed to increase after a meal usually. So when you eat and get all your sugar, more insulin is produced by the pancreas, which then would stabilize your blood sugar. In a type 2 diabetic, your B cells don't secrete enough insulin, or your body doesn't metabolize that insulin correctly, so your blood glucose levels are always almost elevated. The pancreas also stimulates storage of glucose as glycogen into the liver and muscle. The liver and muscle are cells that rely on glucose to function. It also enhances fat deposition and increases protein synthesis, which is super important when it comes to healing in a diabetic patient, because you need adequate amounts of protein and albumin to increase healing and reduce the amount of infections, which diabetics are more prone to get. So with type 2 diabetes, there is a slower onset of symptoms, but it's usually referred to as the 3 Ps, and these are the most common symptoms that people generally experience when they're newly diabetic. So they experience the polyuria, which is increase in urination, polydipsia, which is an increase in thirst, and polyphagia, which is an increase in hunger. Sometimes they feel like they have cotton mouth. From a personal experience, when I was 14 years old and my dad was being diagnosed with type 2 diabetes, he was drinking liters of soda by the day. They were diet sodas, but he's always felt like he had a cotton mouth and would just continuously drink and urinate and drink and urinate. With that, you can also have blurry vision. When my dad was being diagnosed with diabetes, he went to the eye doctor, I think 3 or 4 times in 1 month, because he didn't know why his glasses weren't working. So finally he went to the doctor, and they said that his blood glucose was close to 600, and they gave him insulin, and they said that he was steps away from being hospitalized, but he wasn't, because his kidney function was actually okay. So lucky for him, but I know some people aren't that lucky. Additional symptoms include lethargy, lack of energy, fruity smelling breath, abdominal pain, nausea, vomiting, and sometimes hyperventilation, which is more common in type 1 diabetics. Some additional symptoms that are closely associated with type 2 diabetes are the fatigue, which was previously mentioned, recurring infections. In women, this could be an increase in vaginal yeast infections, prolonged wound healing, and vision changes, which was also talked about previously. On this slide are images of diabetic wound ulcers that are non-healing. On a daily basis, I could have patients admitted to our unit directly from the wound care center with septic ulcers that need stat antibiotics and dressing changes. A lot of the time, these patients, get x-rays done, and it's shown that they have osteomyelitis, and they end up getting the toe amputated or part of that foot removed, which is extremely painful. So these non-healing wounds and ulcers are the leading cause of amputation in the United States. It most commonly happens on the toes and the feet, which is why foot care and wearing footwear is extremely important for your diabetic patients to know that they shouldn't walk around barefoot because of that decreased sensation in their feet. It's more likely that they could step on something or cut a toenail and get an infection and not even know that it happened. So according to an article that I read, each year approximately 200,000 non-traumatic amputations occur. African Americans are 4 times more likely to experience diabetes-related amputations than white people, and every day 230 Americans with diabetes will suffer from an amputation. When a patient comes into the hospital and they have a diabetic foot wound or anywhere else on their leg, and it's decided that they need an amputation, there's a lot of associated risk factors with that. One being increased risk of blood clots after a surgery. So for those patients, we do put them on either like a sub-Q heparin or some kind of blood thinner, maybe even a Lovenox, to assist and aid in the prevention of getting blood clots. they are at an increased risk of developing more wounds because of the lack of mobility that they're going to be succumbed to. So they'll be definitely more in bed and at a higher risk to getting a pressure injury. They're going to obviously experience decreased mobility because of the loss of some extremity, either their foot or their toe. Maybe they already had an amputation previously. So learning how to get up and move and ambulate either with a walker or in a wheelchair, crutches or cane, it's definitely a learning curve and will increase the amount of time that they spend in the hospital. Increased costs of medical related expenses. A lot of these patients are sent home with visiting nurses, or they need to go to rehab. So it definitely costs money, especially for wound care supplies and dressing changes and things that they need to do. There's also going to be an increased visitation to the hospital or the wound center to get these changed if they don't want visiting nurses, having to be out of work due to having a surgery or a procedure, and an increased hospitalization definitely is something that is going to impair your patient's overall healing and mental well-being, which kind of goes into the next part of this, which is impaired body image. So, short story, I had a 29-year-old patient who was non-compliant with his diabetic treatment, ate junk food, McDonald's, Burger King, Wendy's almost every day, liked to play video games and not get up, and didn't refill his insulin pump when he should. So he was a type 1 diabetic, but he came in with a small wound on his toe. They did the x-ray and the CT and found out that the infection had spread from his toe all the way up to his ankle. So they amputated from the ankle down, and he had a hard time looking at his body and coping, and definitely grieved the loss of his foot. He said he liked to wear flip-flops and skateboard, and he would no longer be able to do these things, at least not for a while and without the proper physical therapy. So keeping all of that in mind when taking care of these patients is extremely important. Type 2 diabetes is a condition that can be managed with lifestyle changes. The first one being strict glucose monitoring. So these patients should be checking their blood sugars before every meal and before bedtime so that they know whether they need to hold their oral anti-diabetic medication, hold their insulin, or if they need a snack if their blood sugar is too low. Again, as stated previously, a normal glucose range for a diabetic patient should be between 70 and 120. These numbers do kind of vary from hospital to hospital or place to place, depending on what your doctor says. I've seen 70 to 120, I've seen 60 to 100, and I've seen 80 to 140. So it kind of just depends what your doctor recommends for you. Diet is a huge part of diabetes management. Before these patients are discharged home, they should meet with the registered dietitian or the clinical diabetes educator to go over safer and better food choices for these patients. A lot of times, the patients who need this help are people of the African American or Latino community. Because their cultures are so heavily influenced by food, it's important for these people to know how they can eat their food and practice their culture and their beliefs and take care of their bodies and stay healthy as well. Exercise is extremely important because glucose is stored in fat cells, so weight loss and exercise is a huge part of diabetes management and controlling this condition. Exercise should be, moderate amount of exercise for about 30 minutes, 4 to 5 times a week. And patients, if they're going to be exercising or they exercise heavily, they should check their sugar before they exercise so that they know if it's too low to have some kind of snack that has protein and carbohydrates in it. These patients need education. They can't just leave and go out and make choices by themselves. A lot of them need help, and don't know that they have resources for it. A lot of times the socioeconomic factor is a barrier in the care that these patients receive and the choices that they make. To go with education, alcohol cessation is important, and a lot of times maybe not stopping drinking alcohol, but drinking less and making better choices, like having a low calorie or a light beer is better than having 6 shots of tequila with lime or fruity cocktails, because alcohol, when ingested into the body, it does convert into a sugar source, which is then stored in fat cells in the stomach. So teaching to moderately drink your alcohol or make better choices with that is very important for a type 2 diabetic patient. Along with alcohol cessation, smoking cessation is very important, not because it affects your blood sugar, but because it affects all of the other risk factors that type 2 diabetics are already predisposed to, like stroke, hypertension, and blood clots. Once it's determined that your type 2 diabetes cannot be managed with diet and exercise alone, pharmacological interventions are then put into place. Your first one being your oral anti-diabetic agents, which is your metformin or your Actos. A lot of times doctors will do one, see how your A1C is after 3 months, and then maybe they want to add a second one if your A1C hasn't improved as much as they would like. For diabetic patients, they do tend to like you to be under a 7. Doctors usually don't like to jump right onto insulin, especially if they feel like, you are trying with your diet and you are trying with your exercise, but it's just not enough and you need extra help. Once they see how compliant or non-compliant you are, that's typically when insulin therapy is started. And there's different kinds of insulin. So there's the short-acting, long-acting, regular insulin. So when a patient is put on insulin, a lot of education is needed: how to self-inject, how to store it, when your insulin is good or bad, how to mix it at home if you're mixing normal and regular insulin together, and how insulin will affect you. So a short-acting one, you need to take that insulin with your meal so that your sugar doesn't drop immediately and you have a hypoglycemic episode. It's very important to know that a lot of times your syringes, you might have to load the insulin yourself, but nowadays a lot of times patients are sent home with insulin pens, which are a lot easier, I believe, to teach a patient how to use to self-administer at home. Using insulin is a big adjustment on your daily life and schedule, especially if you're somebody who likes to go out and eat at restaurants, you work longer days. You have to be aware that you do need to check what your glucose is before administering insulin to yourself. Health promotion and prevention for type 2 diabetic patients is to have your patient actively involved in their care. They need to understand the choices that they make and how it will affect their day-to-day lifestyle. Once most patients learn what goes into being on insulin, they do try harder to manage their diabetes with diet and exercise. The first time that a patient notices that they have a wound, that's kind of when they get scared into taking care of themselves and making better choices. For a lot of patients, that's kind of the turning point, and for a lot of them it's not. And sometimes patients don't have the ability to control their situation and their surrounding, so they do end up on that side of being somebody who has an amputation. Teaching your patient to maintain normal glucose levels and using the machine, the glucometers, to check their sugars at home before meals or exercise and before bed is extremely important. Before a patient is discharged home, they should be taught how to self-administer insulin if they're going home on insulin, and the proper way to check their blood glucose using a glucometer. A lot of times insurance does cover the glucometers, and they can have it sent to the hospital where you could teach the patient how to use the machine that they will be using at home. The patients should know the signs and symptoms of a hyper or hypoglycemic episode so that they know if they need insulin via a sliding scale, or if they need to get a snack before they go and exercise or go to work or something that's going to require them to expend more energy. Patients should be going for annual physicals and checkups with their doctors and getting quarterly blood work so that they can check their A1C. A lot of times, once patients are determined that their type 2 diabetes is being managed properly with diet and exercise, they can be taken off of oral anti-diabetic medications to see how their body is doing and see if they don't need these medications anymore. Making sure that the patients are following the lifestyle adjustments like diet, exercise, moderate alcohol intake, and smoking cessation is extremely important, especially as well as controlling any other medical condition or comorbidity that they may have, like hypertension, making sure they're taking their hypertensive medications or high cholesterol, making sure they're taking their statins is extremely important to reduce the amount of risk factors that these patients have. Nurses and doctors should be able to identify at-risk patients and patients that will need more help and more services in the community. Somebody who just had an amputation or a below-the-knee amputation and is now requiring a wheelchair, how are they going to get into their house if they don't have a ramp or an elevator? So looking into socioeconomic factors as well as lifestyle modifications that will need to be made is extremely important for nurses to be able to recognize and be able to communicate with the healthcare team. I want to thank everybody for taking the time to listen to this presentation. Like I said, it was just a general overview of type 2 diabetes and how monitoring blood glucose is extremely important, especially taking care of the chronic conditions and wounds that they could potentially get. My reference page is at the very end, and I thank everybody for taking the time to listen.